Welcome to Climate Curious Quickies, bite-sized nuggets of climate goodness from our TEDx experts in under 10 minutes.
In this week's Climate Curious, we're connecting the dots between the recent virus outbreaks of Ebola and hantavirus with climate change, and asking, can we stop these outbreaks before they start? To help us diagnose the situation and explain how zoonotic diseases can spill over from wildlife to humans, we have a Climate Curious OG, the physician and disease detective, Dr. Neil Vora. On why taking care of our planet is also a medicine, here's Dr. Neil Vora. Stay curious.
A lot of you may have heard about the Ebola outbreak happening right now, or the hantavirus outbreak on a cruise ship a few weeks ago. It's very clear that these are medical crises, but what we don't hear enough about is that these are also signs of a planet in distress. These are symptoms of a planetary crisis. And we're going to be seeing more and more outbreaks of diseases like this because of a changing climate and because of a world in which nature is in decline. My name is Neil Vora. I'm a medical doctor, and I serve as the executive director of the Preventing Pandemics at the Source Coalition. I used to work for the U.S. Centers for Disease Control and Prevention, fighting outbreaks around the world, including in West and Central Africa for the two biggest Ebola outbreaks ever. So Ebola is an awful, awful disease. It is a disease that can kill 50% of people in some outbreaks. It was first discovered in the 1970s. We still don't know the exact source of Ebola, but we think that it originates in fruit bats and basically jumps from fruit bats into people. And Ebola is actually a disease of deforestation. Computer models show that Ebola outbreaks increase in areas that have suffered from deforestation. And there's a few different reasons for this, but basically deforestation and climate change can create conditions that allow zoonotic diseases like Ebola to happen more frequently. So Ebola is caused by a virus. There's actually several different species of viruses that cause what is known as Ebola disease. In the current outbreak right now in the Congo and in Uganda, the species that is causing the outbreak is a more rare form of Ebola called Bundibugyo. And it's one for which we do not have a vaccine. We don't have proven therapies. And so that is part of the challenge in controlling this outbreak. But I do want to emphasize that prior Ebola outbreaks have been controlled without vaccines, and we already know what it takes to stop Ebola outbreaks. And so it's really important that those public health measures get implemented quickly and robustly across the affected areas. Ebola and hantavirus, these outbreaks that are happening right now, are signals of what's happening more broadly around the world. And that is that viruses are increasingly jumping from animals into people. We call that spillovers. And these spillovers have been on the rise around the world for decades. And they are on the rise because of actions that we humans are doing. We are doing this to ourselves by engaging in things like deforestation and commercial wildlife trade and intensive animal agriculture in these awful facilities that don't have good sanitation. And so if we were to address these drivers that lead to spillovers, we would actually be able to prevent some of them from happening at all. But I also want to be very clear. This current outbreak of Ebola, the outbreak of hantavirus, I'm not saying that these are certainly the result of climate change or certainly the result of deforestation. There's a lot of different factors, and we still don't know the precise sources of these two particular outbreaks. But overall, around the world, it is human activities that are causing these spillovers to increasingly happen. There is a growing recognition around the world that human health is linked to the health of other animals and the planet. In some academic circles, this is called One Health, but this is an idea that many cultures have known and understood for thousands of years. And it is increasingly important that we recognize our impacts on the planet and how our changing of environments and changing of the climate is actually going to have health impacts on ourselves. And these are not future threats, but these are threats that are already taking place here and now. And so if we were to go upstream and start addressing climate change more proactively by improving how we manage forests or by sequestering more carbon, we could actually reduce some of these adverse health impacts. Millions of people are projected to die in the coming decades because of climate change, but these are also avoidable deaths. There are things we can do now to save lives right now and also in the future. This current Ebola outbreak is a tragedy of huge proportions. So many people are suffering because of this. And so what I really hope to see is robust international engagement to support the Congolese and Ugandan responses to this outbreak. Beyond that, though, I am hopeful that the world will rally behind certain opportunities. For example, later this year, there's a UN meeting on pandemics, and it's really important in that meeting that discussions happen around the connection between human health and the health of other animals and the planet. We need to be doing more to protect forests, to fight climate change, to improve how we raise farmed animals, to stop the sale of live wild birds and mammals in urban settings. These are all things that we can do. There's solutions at our fingertips already available right now that would reduce the frequency of these spillovers, which would save countless lives. There are so many amazing people that I've met along the way in fighting outbreaks. The people who are responding on the front lines of the response, particularly the Congolese, nurses, doctors, other healthcare workers, those in Uganda doing the same thing. These are heroes. They are putting their lives on the lines by doing this work. I remember when I was in Liberia, I was working out of a rural county, and there was an Ebola community care center in that same area. And overnight, one day, that care center ran out of gloves. And how can the nurses that were working in that care center take care of patients with Ebola without gloves, right? These are people who are facing such limited resources. They are putting their lives on the line. It also reminds me of the time also when I was in Liberia, an infection control specialist himself ended up getting Ebola because it is highly transmissible in those close contact settings. And he begged me to help him get evacuated to the US to get care, but I could not grant him that wish, and he ended up dying of Ebola. And so my heart goes out to these people who are sacrificing so much. They are heroes, and they deserve our support as they fight this outbreak. There's something for all of us to do when it comes to fighting climate change and addressing the threat of new infectious diseases. First of all, I would encourage you to build your own level of awareness on these topics. So go to reliable sources of information. And second of all, as you're trying to figure out what it is that you precisely can do, I would encourage you to ask yourself these 3 questions, which I am adapting from the Japanese philosophy of ikigai. The first question is, what am I good at? Next, what brings me joy? And third of all, what does my community need from me? And my hope is that you land at the intersection of the answers to those 3 questions for you yourself. And as Clover Hogan has said before, we don't need 100 perfect activists. We need 1 million imperfect activists. So you don't have to strive to be perfect. There's something that each of us can do, but only you know what it is that you can do.
Thanks for listening to this quickie.
This episode was created by our superstar podcast team at TEDxLondon. Until next time,
Stay curious.